Oh, there we go. All right. If it's okay with everybody, I think we're about 3 minutes after. Let's just dive into this. I wanted to just really briefly thank everybody for joining us today for our first meeting of the Longevity Ready Maryland Workgroup 4, Optimizing Health, Wellness, and Mobility. My name is Mark, and I will be in part assisting our chair, Rhea, in today's meeting, along with Andrew Baker, who's also part of our team here at the Department of Aging. But before we start, I'm going to ask Andrew to do some quick housekeeping, if that's okay.
Sure, yes. Hello, everyone. Glad to be working with you today. Just a couple of notes before we get started here. I did want to let everyone know that all meetings are being live streamed and recorded, and they will include captions. So if you are hard of hearing or have any accessibility issues with audio, you can go to the bottom of your screen and hit the little circle that says CC, and that will turn on closed captions so that you can view those. Again, since this meeting is being live streamed, your camera will be visible. So if you're not feeling your best, you can always turn off your camera using the camera circle at the bottom there. Members of the public can comment on these live streams and the recordings on each platform. And Mark and I, as members of the Maryland Department of Aging staff, will be moderating those comments, and we will try to share those with the work groups and the chairs as they come in. Just as a point of best practice, all members should please mute themselves when not speaking so that we can reduce any background noise. You can see at the bottom of your screen as well, there's a little button with a microphone, and that will either mute or unmute you. If it's red and it's got a cross through it, that means you are muted, so we will not be able to hear what you're saying. If you have any issues with sound, you can message the chat, and we will do our best to help troubleshoot. You can also see the chat is the square bubble on the bottom right of your screen next to the list of people who are in this meeting as well. We're going to have a little bit extra technical assistance here as well. We're going to be using another platform perhaps to help gather some feedback. So I'll have some more notes for that when that pops up. But for now, I believe that's about it. Oh, if you would like to share any information, there's also the raise hand function that we will be making use of. Mark and I will try to call on folks as they come in. But for now, I believe that's about it that we have for housekeeping.
Great. So, Andrew, if you will please do the honors to hit record and start the live stream.
Yes, the live stream is currently active.
Oh, excellent. All right. Well, welcome everybody to the first meeting of the Longevity Ready Workgroup 4. If you are here for optimizing health, wellness, and mobility, this is your group. This meeting is the official launch of our work group, and we are so excited to be here with you. Again, my name is Mark Tesoro. I am the Cognitive and Behavioral Health Specialist here at the Department of Aging. I'm joined by Andrew Baker, who is also on our staff and will be helping with us with the meeting. And I want to thank you for joining us today to make an impact on how really Maryland enables healthy, longer lives. You will have an important opportunity to identify solutions and help shape our priorities that will inform really our state strategies and plans to support Marylanders as they age. During our discussion today, we are going to be covering a lot of ground. So we'll be learning about Longevity Ready Maryland. We will be introducing ourselves to one another. We will be discussing the purpose and context for the work we'll be doing, as well as the guidelines of the work we'll be doing. We'll break out into breakout groups to discuss our work group priorities, and then some. So, but first, I wanted to hand it over to our wonderful chair, Dr. Rhea, Kerbeck, who is going to be working with us and supporting us through this whole effort. I'm also going to call up our agenda and share my screen, if that's okay. Can everybody see the agenda? Great. All right, Rhea, it's all you.
Thank you. Hi, everyone. I am Rhea Kerbeck. I am a professor of geriatrics and palliative care at University of Maryland. And I see some familiar faces. And I think, Mark, I'm going to do introduction.
Oh, okay.
And know who everyone is. Or you want me to start? I'm okay either way. I wasn't sure.
I think that'd be fine. And I need to really, frankly, apologize to the group because I think I had a template that was going to have introductions and I put it into the wrong file. So I think it's really good that we do introductions.
How you want to start? Do you want to start with your screen?
I'm sorry.
Do you want to start with the screen, with your screen or my screen?
Oh, I don't know. Do you want to present something?
No, I'm just going around just to know who.
Oh, how you want to do it? Sure.
Yeah.
I will go through my list. How does that sound?
Okay.
And we'll just
All right,
introduce
that
each
sounds
other.
good.
And I think you had said, what are the 3 things we should know about you? Is that one of the things you wanted to do, Rhea?
Yes, I think that would be wonderful. Just to get familiar with each other, and so I know. I think we have a group with amazing variable degree of skills and disciplines. So I think it would be nice to know who everyone is, and then I'll start just giving sort of like a brief introduction about the work that we're going to be doing. Does that sound like good?
Good. I will lead the charge and say that my 3 things that maybe you should know about me are I am let's see, I work with the Department of Aging. I started here maybe a year ago. I have a wonderful father who has frontotemporal dementia and a daughter who has what was considered Asperger's. So that drives a lot of my work and decisions that I make as I work on this kind of important work. And I recently moved back to Maryland from Florida a year ago from the Southwest Florida, Sanibel Island. So I'm happy to be back.
And
how about we go with, let me see on my, I think on my list, I'm not sure if it's alphabetical, but I'm going to. Al Moberger, what are the 3 things we should know about you, Al?
Well, let's see. I love big omelets. I'm trying to be funny, but that didn't work. Okay, I'm from Baltimore County, and I belong to 3 different, several organizations, but mostly the Commission on Aging for the Department of Aging in Baltimore County. And I'm on the executive board for the Maryland Senior Citizens Hall of Fame. And I just this morning confirmed with Secretary Ropes that she will, again, confirming her presence at our award banquet on October 17th for 25 selectees that are going to get an award for outstanding volunteer work. And as far as my particular orientation, I'm interested in advocating for the mind, body, and spirit approach to healthcare. I'm very, very heavy into holistic advocacy. I teach it at the senior centers. I practice it myself. And I'd like to see that somehow make it into whatever our deliberations are going to be. The other thing is, most of us, as we talk about our age in our earlier times in life, we tend to forget about it or don't want to talk about it. I want to brag about the fact that I'm going to be 86 in November.
Very good. Excellent. Well done. I hope I make it. Andrew, your 3 things?
Sure.
About you?
Yeah, well, I guess first off, and it goes a little bit unsaid, but I'm excited to be working with this group today. But the 3 things that you should know about me are I work with the Maryland Department of Aging. I've been here for about a year and a half, similar to Mark. And I'm a graduate of the Johns Hopkins Bloomberg School of Public Health. So I like to come at everything with a very systems focused and public health oriented background. So if you ever hear me start using a lot more lingo or jargon or focusing on things from a public health perspective, that's a bit of an explanation for that. And finally, when I'm not working here in the department, I have a very big passion for anything food and fermentation. So like to keep those gut bacteria working properly. All right. Well, thank you.
Yes, sir. Brenda Siles.
Good morning. You may have seen me chuckling. There's a lot of, in those 3 introductions or 4, good stuff to talk about. Mark, I'm in Florida.
Oh, look at that.
Yes, I live on the East Coast, West Palm Beach. And Al, my birthday's in November as well. So who knows? We could be on the same day. What to know about me? I was adjunct faculty for a decade at Montgomery College in Montgomery County. And then from there, I was recruited by county council because I reported on wellness program management that I did at the college for faculty and staff by Montgomery County government to start their wellness program. And I did that for about 3 years when the state reached out to me informally to see if I would start the wellness program at the state of Maryland. And I've done that since 2015. And then in 2019, I made the transition to Florida. My husband is a golf pro. Florida's Mecca. I had no choice. But I will share that my mother is turning 90. She's still independent. She's still driving, which makes me a little, wary, but she's doing very well. And Al, like you, she's a devotee of everything natural, which could explain she's turning 90. So there you go.
Thank you. I appreciate that. It's so interesting to hear what everybody is doing and is up to. Next up, Bruce Fulton.
Yes, good morning, everyone. My name is Bruce Fulton. I live in Howard County, Maryland. I've been the executive director of NeighborRide for the past 9 years, which is a small nonprofit in Howard County that's been around for 20 years. And it's just the simple act of neighbor helping neighbor. So about 300 or so volunteers providing transportation to about 1,600 clients. So mobility, as also its clients and volunteers equally benefit from just the social engagement and community building of the work we do. And interesting, I grew up in Howard County through my high school years, moved away for about 10 years to go to college and do some healthcare consulting in business school, and then have come back and been here since 2000. My mom's still here, so just kind of seeing the full spectrum of life in the county. And then just kind of another, I was trained as an engineer in business school, and I really just like to build. So I found that with NeighborRide in Howard County, and I'm being very excited to be part of this group as we look even more kind of holistically at longevity, ready Maryland, and building the supports, connections, and everything to so we can all age gracefully. So thank you.
Well, thank you, Bruce. Sorry, it looks like Mark was frozen there for a minute.
That's typically, I work in the office and sometimes the office freezes. Casey Saylor, you're up next. What 3 things should we know about you, Casey?
So I love this 3 things model, but that's not one of the 3 things. Don't count that one. So I am excited to see some familiar faces. I know many of you from my work at the Mental Health Association of Maryland, where I built and managed the Connections Project, which was a peer support program specifically for older adults. So that's number 1. Number 2, I now work with the Maryland Department of Health Behavioral Health Administration on their CBAS team, I can't remember the name right now, but the peer support team. And my role there is to promote the expansion of peer support into new and exciting areas outside of the behavioral health system. So I'm very excited to be representing that team today. And my number 3 is I actually just got married in May. So I am changing my name from Sailor to Barna. Thank you. And that is not reflected on any of my official state paperwork yet, but it will be. So if I show up and you're like, who's Casey Barna? That's me.
That's great news. Thank you for sharing that with us. What's your name going to now be?
Barna, B-A-R-N-A. Yes.
Great. Well, congratulations.
Thank you.
David Sharp?
Yes, I'm
things.
a Montgomery County resident. The 3 things to know about me. One is I'm on the board of the Maryland Senior Olympics, and we sponsor competitive events every year, more than 24 sports, and competition is going on right now. Second, I'm a Red Cross volunteer. I respond to fires in Montgomery County and help residents who've been displaced by the fires. And third, I umpire baseball, hardball baseball, for senior men's leagues in Montgomery County. There are hundreds of men in their 40s, 50s, 60s, 70s, even 80s still playing hardball baseball on regulation diamonds. So I umpire them pretty much most of the year. We try to play as many games as we can. So I'm glad to be part of this group.
I think it's so valuable to do this, and Raya was one of the people who mentioned to really take the time to do this, and this is so, I think, helpful to get a better idea of what people's backgrounds are and interests are. So thank you so much for sharing that, David. It's really interesting. Dr. Kogan, Misha Kogan, what 3 things should we know about you?
Hi, everybody. Sorry, the background. It's kind of funny, but in about an hour, I'm presenting on our program of treating and reversing Alzheimer's disease with about 75% efficacy. And I see my mentor here, Raya. So I did my geriatrics fellowship at GW. I stayed on faculty back then. Raya was running geriatrics division at the VA hospital. So I've been around. I'm a Montgomery resident in Silver Spring. We actually just moved from Tacoma to Silver Spring. And clinically, so I do 90% of what I do is geriatrics with primarily impact on sort of holistic or integrated. We don't use word holistic. It's kind of frowned upon in a general standard. So we use word integrative medicine. So we have a practice of about 6,000 patients a year. About 2/3 of them are geriatric population, and 2017 I published first integrative geriatrics textbook international, and sort of I'm a recognized leader in this newly established field. Personally, David, you'd be excited to know that I just signed up. I just turned 50, and I signed up for a crazy endeavor of doing a 50K cross-country skiing. Unfortunately, it won't be in Maryland since we don't get snow, but it's a great American Berkey in Wisconsin. And the other thing, I'm a member of Montgomery County Beekeeping Club for about 10+ years. I have hives, and I love using bees and honey and propolis for all things.
Wow, so interesting. Thank you.
That's awesome.
George?
I'm just going to jump in here for a minute
Yes,
and give a reminder, because Dr. Misha Kogan reminded me. If you do have to hop off before this meeting is over, we will be recording notes and sharing out the video link to this afterwards. So we are here to provide support and help fill you in if there's anything that you think you've missed.
Thank you for saying that, Andrew. Yes, sir. Please let us know if there's anything we could do. Excellent. So can we hear from George Hanawi?
You got it right. Good morning, everybody. George Hanawi. I'm a geriatrician with MedStar Health. I oversee geriatric services with the system. My clinic is in Baltimore City, and I've been serving older adults in the city for the past 20 years, and hoping through this committee we can serve further. On a side note, I'm a big-time Ravens fan, and over here at MedStar Health, every Friday is a Purple Friday, so I don't know if you haven't seen this. Hoping to win the next game. We'll see how that goes. I live in Baltimore County. My kids went to the public schools in Baltimore County, and my oldest right now goes to the University of Maryland, College Park. So I feel we owe the state and the city a lot, and I'm hoping we can contribute to the city, the state, and the care of older adults over here. Thank you for including me, and shout out to my friend, Dr. Kerbeck. Thank you.
You're welcome, and thank you. We're so excited to have everybody on board. Eileen Rosenthal, what 3 things should we know about you, Eileen?
All right. Well, thank you, Mark. Number one, I work for the Alzheimer's Association Greater Maryland. I'm the program director, and I've actually spent my entire professional career in the field of aging, which was a very conscious choice for me because I was born later in my parents' life. I was always around older people, loved them, many great role models, including my own mom, who drove until 100 and was fiercely independent until broken ankle and broken hip. Those joys away. But the other thing is I am OCD about the prevalence of dementia in Maryland. Most of you are very, very familiar, I'm sure, with the fact that Maryland is considered to have the highest prevalence of dementia in the country. And 2 of our jurisdictions, Baltimore City and Prince George's County, are in the top 10 list of jurisdictions with the largest prevalence among those with 10,000 or more people 65 and older. I am thrilled to be a part of this group because I feel like as we look at opportunities to promote successful aging and healthy aging, I feel this is an opportunity to draw on what the research is telling us about those risk factors that can be mitigated and to really push that agenda forward and educate the public and really begin to improve public health by lowering the dementia prevalence. So thank you for your work in this area to bringing everybody together.
Absolutely. Thank you, Eileen. Mr. Sanders, James Sanders.
So happy to be here. I come at this 3 ways.
Oh, sir, it's very hard to hear you. I barely hear you.
Okay.
But not much better, sir. I don't know if you can put, if you can press, maybe there's a little speaker button on the volume.
Why don't you come back to me while I play with this?
Gotcha.
Okay.
Yes, sir. We will come back.
One other thing I can mention here as well. If you do have any issues with your microphone, if you press that button with the eye on the bottom right, that'll show meeting details, and there will be a number that you can call if you need to dial in and use your phone.
Okay, thank you.
Mm-hmm.
Everybody should have an Andrew in their life. That's all I have to say. Janice, and then we'll get back to James. Zaylin?
Yes. Okay. So the 3 things about me that would be useful to know, on the Montgomery County Commission on Aging. So obviously I live in Montgomery County. For many years, I was a long-term care ombudsman volunteer. So know lots about nursing facilities. I am retired and I absolutely love being retired. And finally, which is, I guess, a 4th thing, ever since we got the note saying to decide which of the 4 areas you wanted, which work group you wanted to be in within this work group, transportation, I've been really struggling thinking about which one I'm best suited for and most interested in. So I hope I'm not the only one having that struggle.
No, you're actually not, I don't believe. There are a lot of overlaps, and we'll talk about that later in this as well, that there's overlaps between the work groups and how we're trying to address that as well. But thank you for joining us and choosing us. Ms. Tersini? Janie?
Hi, everybody. Can you see me? Can you hear me?
Yes, ma'am.
Good, good. I'm Janine Tersini. I run the nonprofit Arts for the Aging, which is based in Montgomery County, Maryland, but we also serve Greater DC. And I've served on the Age Friendly Montgomery Advisory Group over the last numerous years, and I'm excited to take part at the state level in making for a longevity-ready Maryland. I live in Washington, D.C., but Arts for the Aging, as I mentioned, is based in Montgomery County. We engage regular arts participation to improve physical, cognitive, and emotional health. I'm really passionate about it because we connect older adults and caregivers with arts workshops that combat isolation and loneliness and spread joy. And we do it by equipping professional artists with the skills and the tools and the know-how to tap into what we know are vital techniques for healthy aging and caregiving. And we deliver these workshops in communities that wouldn't otherwise have them. My motivation to work with Arts for the Aging, and I've been at it for 26 years, arose from the path that it creates for professional artists to earn a living beyond the often difficult commercial route of, selling and performing your original works. It's a practical and imaginative application for uplifting public health. So I just love this work. And on a personal note, I love singing in community chorus. I love film going and just losing myself in a museum. And I love leftover eggplant parmesan. It's great to be here.
Gosh, there's such a wonderful variety of experience here. I'm just so excited. I think, James, did you just join us on the phone line? Did you want to join us? Oh, there you go. Now we can hear you, sir.
Okay, so my three things are, first, I'm on a 35-year business plan based on my mother just having passed 104. I'm 70. Second, I'm heavily focused in entrepreneurship and innovation and have taught social entrepreneurship at the business school at College Park for 30-some years. Now I'm at Hopkins working in the business school on the business of health. So I'm very interested in how do markets and social impact come together. And third, very involved with community groups on the board of the Regional Village Association and National Age Friendly and Housing Improvements. So part of my action is structural change, which I think is in both healthcare and housing. So that's all.
Fascinating. Jennifer Holtz, what three things should we know about you, Jennifer?
Good morning, everyone. So my name is Jen Holtz. I am one of the Associate State Directors for AARP Maryland. So the first thing you should know about me is about my career at AARP. I am primarily responsible for leading the team with our community partnerships and working with volunteers across the state. We're a small team of 7 staff people covering the entire state of Maryland and considered to be the local boots on the ground on all advocacy and outreach measures for the organization in Maryland. And AARP is a 3-pronged organization. A lot of folks think that we're here to sell memberships. That is not the case. We strictly, at the state level, work on the advocacy and outreach side, just purely to help people live better lives. The next thing you should know about me is that I am a graduate of the first class of the Erickson School of Aging graduate program, which really solidified my passion and my desire to stay in the field of aging forever. Learned a great deal about the business and the human aging and the policy side of aging. So even 15 years later, I find that I'm applying those skills and that knowledge every day. The third thing you should know about me is that since 2018, I have been an elected official. I serve on my local school board, and I was president during COVID. So I tell you this to let you know that I am no stranger to challenges and difficulties and differing opinions on important stuff. So those are my 3 things.
Thank you. I appreciate that, the flexibility there and the warning and that guidelines. Thank you. Joelle Ridgway.
Good morning. I'm Joelle Ridgway. I currently am the Deputy Director for the Anne Arundel County Department of Aging and Disabilities. I spent the vast majority of my career working with people who survived traumatic brain injuries and often as a result had early onset dementia. I've always been in a community-based setting with a focus on rehabilitation and probably started working on social determinants of health before social determinants of health was really a thing. And so it's really important. Community health is really important to me, and people being able to age in place how they want to. And that's a big part of the focus of what we do at the Anne Arundel County Department of Aging and Disabilities. I also have a lot of work in disability advocacy, and I served as the ADA coordinator for county government for many years. So I have a lot of knowledge and experience with how we make communities accessible for people. On a personal note, I've had a lot of personal experience with Alzheimer's and dementia in my family, specifically my mother, and then several other relatives. So, you know, from a personal perspective, it blends well with sort of my life's work. And so I'm happy to be here and contribute.
Thank you so much, Joelle. Carrie Gorkas? Carrie, are you there? No, we can go back. I'm giving you a chance to unmute. Carrie Gorkas. All right. We'll go back if you're there, Carrie. Kim Burton. What 3 things should we know about you, Kim?
Hi there. My name is Kim Burton. I have spent my entire career working in the field of aging and feel very passionate about mental wellness. I am currently an independent consultant and educator. I do training around issues of cognitive impairment, substance use disorders, mental health, just behavioral health in general. I am excited to be living in my 60th year, so formally now a person who can be considered an older adult, and I am reaping the benefits in some of my community wellness programs. And I really want to say that I have worked in advocacy in Maryland for like almost 30 years. And I have never been more optimistic about the work of the Department of Aging and the leadership of our great secretary. So glad to be part of this. Thanks.
Thank you so much, Kim, for the kind words. I appreciate it. I'm excited too. Trust me, working here. Carrie was saying that she's having trouble unmuting. I don't know if that is from the microphone on your end, Carrie, or if you have muted yourself on your computer itself, where you need to just press the volume keys or not. But if you need to call in, you can call in as well, as Andrew was saying. Oh, you're welcome. Levon Stillwell.
Yes. Hi. Can you hear me?
Yes,
oh,
ma'am.
Okay. I'm a little camera shy, so I'm leaving my camera off. I am a retired nurse, registered nurse of 30 years, and I've worked in all capacities of nursing, oncology, HIV, orthopedics, AIDS. I've spent the last 21 years working in occupational health at Johns Hopkins. I received my master's degree from Walden. I am a veteran of the United States Air Force. I belong to the Maryland Coalition of HIV and Aging, and that's how I ended up here today. I volunteered to participate. So I'm excited to be here, and I'm looking forward to bringing my years of nursing experience and advocacy to this group. Thank you for having me.
No worries. Thank you for such a nice introduction. I appreciate it. Leanne Eagle. Leanne, what should we know about you? 3 things.
I was a founder of the Maryland Living Well Center of Excellence. I'm the chief of this program. It was actually developed by the Maryland Department on Aging and way back into 2015. And we were one of the first 12 hubs in the UNS. And we are really priding ourselves on all the hub work that we're doing across the state of Maryland and the work we do with the State Department on Aging. We work a lot with dementia. We work with Mark and several others in the MDOA team. And personally, I just enjoy my 3 grandchildren very much at home.
I have
Thank you for having me.
Leanne. Yes, ma'am. I have the pleasure of working with Leanne fairly regularly, so I'm glad you're on board. And Leslie Smith Ray is on board. Leslie, what 3 things should we know about you?
Oh, hey, I am so sorry. I'm out in the field, so I can't get on camera myself. But so yeah, Leslie Ray. I work with Mark and Andrew at the Maryland Department of Aging. I've been here about 8 months. I worked in senior housing my entire career here in Maryland, and I'm kind of just peeping in on this work group. It sounds really great because I have my own work group next week where we're going to be dealing with family caregivers and direct caregiver and workforce groups under Longevity Ready Maryland. So I think all of us, Andrew and Mark and us, we're all just trying to watch how these work groups get going. It's very motivating, and definitely appreciate all the kind words everyone have of this effort that we're all working together on. So thanks, Mark, for letting me sit in and watch your meeting. I appreciate it.
No worries. We learn from each other, and this is a work in progress. So thank you, and thank you everybody for being patient as we work through all this. I think Carrie is back online. Carrie Gorkos?
I am. Thank you, Mark.
Oh, there
Sorry
you
about
go.
that.
No worries.
Okay, so 3 things you should know. I am the Vice President of Community Programs at HI, or Comprehensive Housing Assistance in Baltimore City. I oversee a senior center, our village, some of our community engagement work, and we're also starting a small transportation program. I, like Janice, have been just very torn between 2 of the kind of categories that we're going to break into, so struggling with that. And then just personally, I'm very grateful, although slightly overwhelmed, that school's back in session and my kids are back in school. So thank you.
Well, good luck, and yes, I understand the stress involved with that. So, Marlene Riley, what 3 things should we know about you, Marlene?
Good morning, everyone. So I'm an occupational therapist, and I grew up in Baltimore City and now live in the county. So those are still the 2 jurisdictions I'm most interested in. I started out the first 10 years working in Union Memorial Hospital. So I have a hand therapy background from that experience. And then the last several years, I taught at Towson University in the OT program and have been very involved with the Baltimore County Department of Aging. I'm on the commission and also the Image Center for Independent Living. I retired from teaching 2 years ago to timed it with my first grandchild and also continue with private practice. I do in-home environmental assessments, participate with the waiver, Medicare B, and also balance that with volunteer work. I volunteer at Lake Roland and lead accessible walks. I think it's really important to get people outside in nature, and a lot of park services are not accessible. So that's a area that I really like to focus on now as well.
Thank you, Marlene. I volunteer at Lake Roland myself, so we have to catch up at some point. So the next up to bat, Mary Jo Deering. What 3 things should we know about you, Mary Jo?
Good morning, everybody. I'm the president of the Washington Area Villages Exchange. And Carrie, we have HI as the HI Village as one of our villages. They've even won one of our awards. I started by creating my own village in Bethesda, Maryland, and then merging it with another, and then went on to the WAVE board. And I've been the president now for 4 years. We have a grant from MDOA with Chelsea Wheeler's group, the Supportive Communities, to promote and support villages. And I want to ask a question, whether people would give permission to share their names, titles, and contact information, because that would be very valuable to me. We have a wonderful conference coming up on October 17th, where Dr. Michael McGinnis, who is the head of the National Academy of Medicine, and who literally identified the social determinants of health back in 1993 and created a lot of the ability for us to all do what we're doing, is going to be our keynote speaker. And so I really want to, be able to share that with you. I will say I knew Michael because he hired me into the federal government, where I remained for 27 years. First in the office that did the Healthy People activities and the U.S. Preventive Services, and ending up in the office that did the policy for electronic health records. And in all my time across the federal Department of Health and Human Services, I was always the person with the voice for the person-centered approach to what we do. And on a personal note, I'm very lucky that my 2 adult kids, and each of whom has 2 grandkids, are all in the DMV in Montgomery County, and I can get together with family very often. But I do hope that people would perhaps opt in to share their contact information.
Well, yeah. So here's the thing. So we have, and they can contact you directly, but in part of our shared folders is a contact list of everybody that is there. I think they would reach out to you and maybe and give permission to participate, but certainly there is a shared link, an Excel file, frankly, that is everybody's contact information on there.
Okay.
So I would, yes, ma'am.
But my email.
And,
so thank you.
And again, just as a point of clarification, since these meetings are publicly recorded and publicly shared, if you would please refrain from providing any of that contact information just in this meeting as well. If there is something that you would like to share with the group as a whole, you can email that to me, and I can make sure that we send that out to the group email as well.
Thank you, Andrew.
No worries. Thank you, ma'am. And it sounds like a wonderful opportunity. Melissa Karcher.
Hi,
what 3 things
everybody.
you know about you?
Hello. So first, hi, Marlene. I'm also an occupational therapist. 30 years, I have worked in acute care, subacute rehab, long-term care, a little bit of home health, and then about 4 years in the school system. But my specialization in my master's program was in the with geriatrics. And I currently work for BHA, Behavioral Health Administration, as an older adult behavioral health coordinator in the treatment and recovery department in the older adults and long-term services and supports. Personally, I'm a widowed mom of 3 boys. My husband was diagnosed with terminal brain cancer and passed 14 years ago. So I was a family caregiver. My father-in-law is a family caregiver to my mother-in-law with dementia, and my parents are family caregivers since 1995, multiple family members. So family caregiving is a huge, I think, piece that we need to look at as well. The third thing I would say is huge Orioles and Ravens fans. So it's nice to see you all and meet you all. Look forward to working.
Yes, ma'am. Thank you. Peggy Funk. What should we know about you, Peggy?
Thanks, Mark, and good morning, everyone. So again, my name is Peggy Funk, and I am the Executive Director for the Hospice and Palliative Care Network of Maryland. Great to be with you all here today. I've been with the network for about 10 years, and also since we were talking about conferences, just wanted to mention that we also have a conference coming up on September 25th at the Maritime Conference Center. And the keynote speaker will be Secretary of Health, Dr. Laura Herrera Scott. I'll make sure everyone gets the information. When I'm not doing network work, if you will, I'm actually a master gardener for Baltimore County. So again, looking forward to working with you all.
Great, thank you. I appreciate that. And again, just to reiterate what Andrew was saying, if there's information you'd like us to share to the group, we're happy to push that out to the group.
Awesome.
We just want to respect everybody's email addresses and our files and all.
Yes.
But thank you.
Okay, thank you.
The wonderful pleasure of introducing our chairperson, Raya Perbeck.
Yeah.
Would you like to introduce yourself?
Oh man, I am just so impressed at all with all the professional and personal experiences of everyone. I know that Andrew and I will be learning so much, and so much appreciated. I am an internist and a geriatrician and a palliative care physician. I was hired at the University of Maryland 5 years ago to build the palliative medicine program. I worked in long-term care, home-based primary care, subacute, so I just different and varied capacities. I had amazing bosses that allowed me to grow and do all the things that I wanted to do. My interest in joining and being part of the group, my research interest is centenarians. I had the honor of caring for a patient who was 108 years old, and I was always so impressed with how sharp and resilient, and that got me really interested in the blue zones and learning more, joined the international Centenarian Study Consortium, traveled to the blue zones and got really to learn about what I call expert survivors. And I thought, maybe we can take best known lessons from this amazing group and implement in the younger generation and people that we care for across our continuum of care. So that's me. I was also very close to my grandmothers. So that's really my interest in geriatrics. And I always say, I get paid to do work that I really would love to do anyway. So, but don't tell my bosses. So I'm really excited about being part of the group.
I agree, and I've had the pleasure of just interacting with Raya recently, and it's just I think we're in very, very good hands, and looking forward to doing a lot of good work with this group. Last but not least, Robin Riley, and is there any relation?
I don't know. We'll have to check it out. I don't know. I'm originally from Cecil County. I don't know if that helps or not, but hi everybody. I'm really excited to be part of this group too. My name is Robin Riley, and I'm the very proud director of the Montgomery County Department of Recreation, and I've had the great honor of working here. This is my 43rd year. Came out of University of Maryland as a phys ed major, fell in love with the field of rec, and just have worked here ever since. We operate 8 senior centers that are 5 days a week, sometimes 6 days a week. We also have 8 neighborhood senior centers. And I think someone here talked about Maryland Senior Olympics. Well, we're the host agency that helps facilitate and run everything from track and field to swimming to bocce to bicycling. You name it, we do it. It's one of our greatest activities to be able to participate and support. So I'm also the co-chair for the Friendly Committee. So happy to be here.
Happy to have you here. Sorry, it looks like Mark got frozen there for a minute.
Mark, I bored him to death. He just froze right up.
Hey, Mark, do you or Andrew, would you like
The Department of Aging?
Oh, sorry, Mark, we're losing you again there.
I'm gonna, if it's okay, I'm gonna take my, maybe it'll help if I take my camera off. And is that any better?
Mm-hmm.
Yes, we can hear you now.
Mm-hmm.
No? Yes? A little better? I just wanted to thank everybody for introducing themselves. And one of the things I wanted to mention was that I'm just, again, very excited to have this. Oh.
I think he's gonna try to log in again, maybe.
Log out and come back, yeah.
Yeah, I think so too.
Well, sorry about that. I don't want to address the elephant in the room, but we are having this first meeting on Friday the 13th, so there was bound to be some sort of shadow lurking over this meeting. So I apologize for that. But
So, Andrew, I can go ahead and we can move on with the agenda for you know, if you would like, I can give the overview. Where I don't know where we are with the agenda. Do you wanna?
Yes, that would be great.
So out of respect to everybody's time.
Yes, that would be great.
Okay.
Thank you.
All right, you're welcome. So everyone, I don't know, we're all just so busy, and I don't know how many of us had a chance just to go back and review all the materials that were sent to all of us. But I thought I would just give a quick overview of the initiative and then focus on our work group in particular. And so I just wanted again to reiterate. I'm sorry, I'm just hearing a shot. I think if you're not talking, you probably want to mute yourself so it doesn't, because there is an echo, I think.
Yeah, sorry, apologies. Whoever has the 239 number, I'm going to mute you for the moment.
Oh, we can do that already. All right, so I wanted to reiterate, Mark's welcome, and I say again, welcome to the Longevity Ready Maryland initiative, and thank you so much for joining this important effort to optimize health, wellness, and mobility for the state of Maryland as, residents as they age. So the LRM, the Longevity Ready Maryland, is a strategic 10-year multi-sector plan developed by the Maryland Department of Aging to address challenges and opportunities that come with an aging population. So as Maryland prepares for a significant demographic shift towards an older population, the initiative is structured around 4 comprehensive goals aimed at fostering more inclusive, economically secure, and healthy and connected environment for older citizens. So it's really both a privilege and a responsibility to participate in this transformative process. And we are really honored to have your expertise and commitment to charting progressive and inclusive course for our state. So as members of this work group, we have unique opportunity to shape how Maryland addresses critical issues surrounding aging, ensuring that the people we care for caring for each other, for people that we are privileged to care for as well, they not only live a longer life, but enjoy a healthier, more fulfilling, more active years ahead of them. As you all know, the Maryland population is changing. By 2030, we are expected to have 25% of the state's population over the age of 60, and that shift presents both challenges and immense opportunity. Then, for our work group, we will focus on investing in healthier lifestyles that promote longevity and delay dependency. For all of us working in the field of aging, we have this mission to age in place. We talk about it all the time, ensuring that, Marylanders can maintain their independence as long as possible, and be as independent as possible in a non-institutional setting. And so we will address a wide range of priority areas in enhancing person-centered model of care, given really great attention, just like Al mentioned, the mind, the body, the spirit. It's a holistic look at the individual. Improving transportation infrastructure to ensure older adults can move freely and safely within their community. That really affects following their appointments and coming to see their doctors, connecting with each other, and be socially immersed with each other instead of isolated. Expanding access to mental and behavioral and cognitive health services to foster brain health and reduce isolation. As you just heard, Maryland has a very high rate of Alzheimer's disease and related ADRD, Alzheimer's disease and related dementia. encouraging social connection. And now after COVID, if there was a silver lining for COVID, now we know that social isolation affects health outcomes. So provide purpose and reduce the devastating effects of loneliness, which is increasingly recognized as a significant health risk. So our state is really positioned uniquely to lead the space with a track record of forward thinking in policies and initiative. And it really is breathtaking just to know what each and every one of you is doing in your own area. So Maryland has been the forefront of innovative healthcare models and equity-driven reform. So now with the Longevity Ready initiative, we are poised to make significant impact and stride, ensuring that aging in Maryland not only feasible, but empowering for every individual. And that's really ensuring that every Marylander deserves to live a life of dignity, of health, of mobility. So I wanted to say thank you for your dedication to this cause. Together, we will create a blueprint that sets a new standard for what it means to age gracefully in a progressive state like Maryland. I am confident that with your passion and what I just heard about your knowledge and commitment, we will build solutions that would empower all of us and older citizens and enhance the quality of life for generations to come. And we make Maryland a leader in aging as well. So thank you so much. I'm going to give the microphone back to Mark. I don't know if Mark is back with us or Andrew. Sorry, I don't know if I took more time than I should have, but
No, you are all good.
okay.
Can you hear me okay?
Mark, you're there.
Yeah, sorry about that.
That's all right.
Hopefully you can hear me and it's not too echoey or anything. So I bear with me as we have a very old building here and very old systems, but hopefully we'll be changing that soon. So bear with me. And thank you for that introduction and kind of clarification. We are running a little behind, but I don't think too far behind. So I would like to just do a quick presentation, if I can, of just to get us all on the same, level, set the playing field. So I'm not sure if everybody has had an opportunity to review the packet that we provided everybody, but I did want to provide some information to the group, if that's okay. So if it's all right with everybody, I'm going to share my screen. Let's see how this works. Let's see here. One moment. Yes, this should be good. One moment, please, and let me just share my quick presentation. Can you see my, oops, 1 second. Can you see my screen?
Your desktop. That's it.
Yes,
Looking
we've
good?
got the presentation now.
Great. So let me just quickly jump into this, and I know that we're running a little bit behind. So a lot of this material is going to be in our packets that are provided. So I will quickly go through it just to make sure that we are all on the same kind of playing field here, so that we're all on the same page. So Maryland, as Ray was suggesting and mentioning, that population is actually booming, right? In terms of, I think we're all aware of the significant size of the current population of older adults in Maryland, and the exponential growth that's expected over the next few years. So frankly, with this in mind, Governor Moore signed an executive order on January 3rd of this year, making Longevity Ready Maryland a priority for the Department of Aging. We have a number, Longevity Ready Maryland has aligns with the really the framework that is included in the state level National Academy of Medicine's 2022 Global Roadmap for Health and Longevity. And frankly, it's a great framework to frame our conversation. And there's a wonderful quote that I think captures the work that we're going to be doing here. If you'll indulge me a little bit from this work. So it says, "A clear eye, evidence-informed view of the capabilities and vulnerabilities of older people points to the very real potential of aging societies to be, on balance, positive. It is important to recognize the substantial socioeconomic gradients that drive vast differences between advantaged and disadvantaged populations within and across countries. Together, these observations suggest that long-lived populations are not inherent problems for societies. Rather, the problem for societies is the barriers that systematically prevent people from reaching their later years with the good health needed to thrive and contribute to family and society." So I just love that quote. And as we begin our work, I think it's important that we be cognizant of the major disruptors to health and longevity, including ageism and preventable disease and poverty and inequities. For Maryland to be prepared to meet the needs of the older population and build for a future of healthy longevity across all Maryland communities, these long-standing and systematic inequities and disparities experienced across the lifespan really have to be addressed. So I just wanted to make sure we mentioned that and that we shared that kind of view. Just to provide a little bit of background, there are 4 epic goals that are being worked on simultaneously that include this group as well. That is building a longevity ecosystem. Oops, one second. I am throwing myself off here. So this is, I just wanted to make sure that we were aware that this, the work that we're going to be doing aligns very much with the vision of the Department of Aging. So that is being healthy, financially secure, socially connected, and purposeful. And by planning for this together, we can inform our state and local partners to really build momentum on bring about significant and positive change, including establishing and implementing, integrative and integrated care delivery systems. So with that being said, there are 4 epic goals that we are working on simultaneously. One of them is building a longevity-ready ecosystem, which really talks about really addressing ageism and speaks to the villages model. Another work group that is going on is the promoting economic opportunity, and that's really working with the workforce. The third group is preparing Marylanders to afford longevity, and that is really looking at affordable housing and financial security. And our work group is, which I think is my favorite, obviously, is optimizing health, wellness, and mobility. And you'll see that our recommended priority areas are person-centered care, transportation infrastructure, brain and physical health, and social connections and sense of purpose. So each of you was chosen to work within our work group here based on your expertise and what you bring to the table. Defined objections within our recommended priority areas are included in the work group information and resource packet. And while these objectives are based on a number of different contributing factors, we're certainly open to some flexibility if you see that if the group feels that there should be redefined or revised. I also thought it was, it's also our recommended priorities are very similar and reflect the 4 M's framework, if you're familiar with that. So really what matters aligns very much with the person-centered care priority area we're looking into. That medication is somewhat aligned with our physical health priority area. Mentation aligns with our brain health and social connections and sense of purpose priority areas. And mobility obviously aligns with our transportation and infrastructure priority area. So if you're familiar with those 4H framework model, that's very similar to what we're working with and our priority areas here today. In terms of meeting logistics, Maryland's Open Meeting Act requires that all meetings and information will be posted online. And due to the public nature of these meetings, we just want to make sure that everybody is participating and demonstrates professionalism and respect at all times. The meeting agenda and the minutes will be uploaded to our work group folders within 2 days of each meeting. And the links to those folders will be posted online and accessible to the public. Raya will lead the meetings with assistance from both myself and Andrew, as you are experiencing. There are some common procedures. While each of the 4 work groups have very unique responsibilities, there are collective considerations that we were talking about earlier that are common amongst all the groups. Several of these considerations are factored into the template that we'll be using to create recommendations. So it's important to not lose sight of these as we work on our work. In fact, if we come up with multiple recommendations, for example, the group may want to use these considerations, these common procedures, to help prioritize those recommendations. And what I mean by that is, for example, does the recommendation build upon existing plans, recommendations, and resources? Does it promote equity, social justice, and inclusion? Does the recommendation ensure person-centeredness and choice? Does it improve efficiency and collaboration across sectors? Does it enhance access to technology-based solutions? And does the recommendation promote community-led design, execution, and evaluation of solutions? So just to kind of keep that in mind, there are many different levels of recommendations that our work group may want to consider. As you can see here, the public policy level is really what we're looking for. The public policy level encompasses an impact on the other levels, the community level, the institutional level, the interpersonal level, and the individual level. So while, let's say, community model or community level is important, we're not trying to minimize that. However, that public policy level is really what we're looking for in terms of really having a larger statewide impact on health. You'll notice, and hopefully you've all received the work group information packet. That is, we ask you to review it closely. The packet includes all kinds of information and links to just about everything you need to get started. The file sharing platform we're using is Google Drive, so you hopefully are familiar with that and will have access to that. We've opened it up to public accessibility. Each workgroup folder includes various subfolders where we have meeting agendas and meeting minutes and work documents and just additional resources to go through. Again, the contact list of the workgroup members are also included in each folder. But you'll find all kinds of information about existing state agency initiatives, as well as national reports and briefs and planning documents and data sources. So what we're asking is that these resources are used to really jumpstart you and your path towards developing recommendations. As we discussed, the recommendations we develop as a group should be built on existing plans, right? We are not interested in reinventing the wheel, but we want to make sure that we're building upon the previous existing plans, recommendations, and resources. So we ask you to try to take out of there what you think about how to make what the information that is there more impactful, more relevant, and more actionable for our state. The goals of our first meeting today is really to just introduce the team members to each other like we've been doing, to discuss recommended priority areas, and considering that breakout groups or committees to try to get an idea of what different breakout groups and who should be in potential which group, as well as to assign roles to groups that we may want to consider. Our work group will create or should create a schedule that includes researching available materials, identifying any gaps, defining what your objectives are, and creating strategies for meeting those objectives. And the available template in your packet is there for us to structure recommendations. Measuring success is really in the packet as well. And that really should just be making sure that we have SMARTY objectives, which I'm old enough to remember SMART objectives, but they are now SMARTY objectives, which are specific, measurable, achievable, realistic, time-bound, inclusive, and equitable. It's also recommended that the group should be inclusive in its approaches to emphasize older adults and valuing diverse perspectives, acknowledging the impact of health disparities related to age, race, gender, identity, income, sexual orientation, and other factors. It's recommended that we promote access and equity and choice. Our recommendations need to be built on enhancing, again, existing strategy plans and policy. I did want to give a little bit of an idea of the planning process if you haven't seen this before. So we are the work group members in the very far left box there, but there are other work groups and work group chairs. So the work that we develop will be looked at by the work group chair, Raya, to kind of take a look and disseminate. We also realize, as we mentioned earlier, that there may be overlap between the different work groups. And our stakeholder advisory group will be coming together between our work groups meetings to discuss the progress of our group, identify redundant conversations or gaps in discussion, and ensure that we are progressing towards our aim of developing objectives. And then it will go to a cabinet council that reviews and edits and approves the recommendations, and then eventually to the Department of Aging to coordinate a more formal draft that will be reviewed by the governor. Our timeline is very aggressive. November 15th is when we're looking to have the group recommendations due. By December of this year, the Cabinet Advisory Council, as I mentioned earlier, will look over those recommendations and make their recommendations to us. A draft plan will be shared between January and February of this year, or next year, excuse me. And that draft plan will be open for public comment. They are already planning town halls and different other venues to have some feedback on that draft plan. That plan will then, with that feedback, be changed if necessary and improved upon, and then submitted to the governor and ACL for review. And when the final plan gets submitted, by July 2025, it will be ready for the governor's approval and review by ACL. So that's our aggressive timeline. And I do say, I think I'm very excited about us getting started. I did want to include that very, very interesting to me and very excited about what we're doing, because these types of exercises really in the past have helped us provide additional support to caregivers. Investments in villages and village growth have increased transparency in continuing care retirement communities. Have better trained state staff on earned income tax credits and regulatory relief to assisted living centers. So advocacy accomplishments in the past these kinds of activities have helped us focus on aging in place and combating ageism and quality improvement over long-term care and just improving our skill sets in what we're doing. So I'd like to just provide the, some of those accomplishments of what we're, what the end goals are. And with that, I will just say that I just wanted to make sure that we are all on the same page. I'm glad for you to give me the time to do so. I do want to make sure that we do stay on our agenda, but I did want to share that information with the group. So hopefully our agenda here, let's see. So I just really wanted to just get through that, so I appreciate it. Before we break, I wanted to just talk to Andrew and the chair if you wanted to discuss, and I've talked way too long, and you guys are the experts, so I apologize. That's the longest you're going to hear me speak, I think, because this is all about you and what you guys are able to provide us and your expertise and your feedback, so thank you. But I didn't know if we should try to figure out how we want to kind of prioritize our different groups. Are we comfortable with them? The person-centered care, the transportation and infrastructure, the social connection, and the brain and physical health. We've taken some time to really think pretty hard on it, and that's what we landed on.
I think so. And I think, I mean, how about we let people self-identify with their group, and we just have to take a look at the end and make sure that the 4 areas are balanced in terms of participation. And we have varied expertise, and I think we have them very well covered. Instead of assigning, I mean, just what do you think?
Yeah, I'll share that I have a virtual whiteboard that I can put up here, and we can have people put sticky notes on where or which group they would like to participate in.
Yeah, go for it, Andrew. I think that's a good idea.
Casey has her hand up.
Yes, I do. Thank you. So quick question on the previous presentation. You mentioned that ACL is part of the review process. And I was just curious, how do they fit in to this? Are they funding that outcome? What's their status in this process?
I don't believe they're funding the outcome as much as providing some guidance and resources and some recommendations on their own side. But I don't believe there is a funding component necessarily tied to these recommendations.
Okay. They were up there with the governor, so I was just curious as to how they fit into it. Thank you.
Yes, ma'am.
I also just want to note, for myself, looking at the different breakdown of the groups, I guess I don't think it's specific to the peer support lens, but to the mental health and behavioral health lens in general. Brain health is so tied into social connectedness, I don't think you can tease them apart. And so I just want to say that out loud. And if we are going to have 2 separate groups, I hope there's lots of collaboration between them.
I very much agree. I don't know. It's up to the group really to decide on whether they should be combined or kept separate. What does the group think? That's a really interesting suggestion.
Hello, this is Brenda Salas. I do have a question. I'm looking at the physical health and then I'm looking at the social health and sense of purpose. To me, those are equally as intertwined as Casey's point about brain health. I'm thinking about, for instance, Robin's role, Robin Riley, and how my role overlap. And I'm sure that she would agree that physical health that we're offering through the various wellness programs and social senior centers is every bit as strong as how that supports social connection.
Yeah, agree totally. Yep.
Well, this is
Andrew, are you using your whiteboard?
Oh, sorry. Here, let's see.
I think it would be really nice to take all these recommendations, suggestions, and Thanks
Yeah,
so
no,
much.
I agree. Let's see if we can jot all this down. I appreciate it. And I will agree. I do want to give the perspective from I know that there's a very distinct line between physical and behavioral. And while I am a very big fan of holistically looking at these things or integrated looking at these things, the state tends to kind of still separate out. But maybe that's something that we discuss and make a recommendation for. So it's up to the group.
I thought I would just, oops. I thought I would just jump in here and add to when I was looking at, I don't have the names of the focus areas in front of me, but I wondered about physical, cognitive, and emotional health. These three prongs of health, rather than just talking about brain health and physical health, to make things more complicated.
No, I like it.
Physical, cognitive, and emotional health.
Cognitive and emotional. And I saw, I think it was Kim's hand up. I'm sorry. Did you put it down, Kim? Oh, there she is.
Yeah, I like what Janine just offered, and I would agree. And I think we're going to always bump up against the overlap. So perhaps we can just, like, from the beginning, have some overarching recommendations or acknowledgement that these things are interconnected, so that we don't spend too much time always trying to tease them apart and pull them together. It's just such a puzzle. The other thing I also know is that we can get very caught up in the semantics, the language that we're going to use. And I would advise that we try not to do that, and maybe we have some place where we can hold what all of our ideas are around the different language that we use. But sometimes I think that can hold up the work.
I agree with Kim about that, because what crosses my mind is where are we dealing with the public stigma about ageism? In other words, are we going to address that in terms of how aging is being perceived? And as Kim was pointing out, the language that we're using to keep calling us seniors and to keep criticizing or bringing things up as if we're a separate class of people. So I'm in for that integration there, and I don't want that language to confuse things, but somewhere in our group, we ought to be able to make a recommendation about having the public change those images. And how can we cause that to happen? Thank you.
Before we get too far here, I do want to apologize. Again, we are having some technical issues with getting that whiteboard. But I realize that we are also at an hour and a half into this meeting, and I know that on the theme of accessibility, there are some people who have a bit shorter attention spans. So if we wouldn't mind, would we be amenable to a 5-minute break so that I can sort out this technical issue, and we can kind of capture some of that input in a more organized format.
Sounds good.
All right, that would be much
What do you think,
appreciated.
Madam Chair? How much time should we give? 5 minutes? All right, we'll reconvene at let's say 11:30. Little after 11:30. 11:30, a couple of minutes after.
All right, and at this point, I will